tonight's last form of the evening. My name is Nicole McGruder. I am the Executive Director of Community Hero Action Group, and we are here today at the 2022 Pennsylvania Black Health Matters Conference. Disrupt and Build Up is our theme this year. And this particular segment we are super excited about. We have the wonderful Andrea Lawful Sanders moderating this conversation. She is known as a fantastic host on Word Radio. She also started A Lawful Truth Enterprises, something called Mother Diva that she's also referred to, and she shared facets of her life through short stories on social media. She's confronted the hard truths between where they are and where they aspire to be. In the midst of her truth-telling emerged an idea to help others share their stories and be their most authentic self. A creative herself, she vowed to create the same space for future generations, thought leaders that would impact and transcend all limitations in the world. Today, that vision continues as she helps her clients ranging from college students to professionals strengthen and develop their leadership skills that will make them more competitive in today's workforce. She leads dynamic workshops that encourage and promote leaders to ascend with confidence. Mother Diva believes the world needs more creative thinkers who can quickly adapt to their environments, thus generate more revenue for their businesses and meeting personal and client goals. More importantly, thought leaders who will impact the business world. And she is here tonight. And she will be facilitating the conversation. I will go ahead and hand it over to you, Andrea, in one moment. And one other thing I wanted to mention, and I just realized something very important. We actually have another guest who I do not see on yet. Here she is. I see you now, Emma. So Emma is our guest artist this evening. Sorry about that. Emma Wimberly is our guest artist from the Ink Factory, and what she'll be doing is creating live visual notes. Nice. She'll be synthesizing our words and images into text to visually represent the key concepts and themes of tonight's conversation. We know that visual notes boost understanding, learning, and information retention. So thank you so much in advance for your skills, and her graphics thus far have been great all day long. And what we plan on doing with these graphics is at the end of the conference, we're going to use them to create journals, and we'll sell them from Community Hero to raise funds for Community Hero. So anyone that is interested in purchasing these journals with these graphics, please be sure to reach out to us. But we will be sending out information when we send out the survey. So just check it off that you're interested in purchasing the journal, or if you're just interested in the artwork that she's going to actually put together tonight, just let us know. So thank you very much, Emma, for joining us for today's last session. Now, I will hand it over to you, Andrea.
Good evening. As we continue to embark on today's theme, which is women's health and wellness, tonight we have three phenomenal women who will have discussions with you about questions you've been too embarrassed to ask, a candid discussion about gynecological health, contraception, and libido. Now, if you've been a part of the Black community for as long as I have been a part of the Black community, then you know some of the things that we're about to discuss has always been considered, taboo, right? Can't talk about it, go into the corner and let's not deal with it. Tonight, we're going to debunk everything that you've always wanted to know and ask. Our panel are Dr. Beverly Vaughn, who is a specialist in gynecology with more than 20 years experience. She's a member of the medical staff at Mainline Health's Lankano Medical Center. Miss Lynette Medley, who is no stranger to this mother, is an activist, author, and counselor with over 20 years experience in the area of sexual health and wellness, and she will give it to you straight, no chase. I'm telling you, so get yourself ready. And she is also the founder and CEO of No More Secrets, a nonprofit organization that provides free menstrual products to menstruators in the Germantown area of Philadelphia. Congratulations to that. I saw that you had a building opened up. Huge feat. Shadeen Francis, I think is the youngest one in our group here, is a licensed marriage and family therapist, board certified sex therapist, educator, and author that specializes in demystifying pleasure, building emotional intelligence, and the intersection between sexual wellness and social justice. To learn more about each one of these phenomenal panelists, please click on the speakers tab within the conference for their full bios. There will be time also reserved at the end when the panelists will share more about their current initiatives. All right, tonight we will be creating a safe space that addresses the intersection of the physical state, the mental state, and social well-being that has a connection with sexuality. Our goal is to increase awareness regarding sexual wellness, inspiring attendees to have a positive and respectful approach to their sexuality and sexual relationships. This forum is going to be divided into 4 parts: contraception, sexual wellness and health, post 50 plus conversation, the one that I am most looking forward to, and we will have our audience question and answer. All right, let's go. We will delve into these topics from a clinical, psychological, and social perspective. We have a diverse panel that will address questions from their area of expertise. So feel free to post your questions in the chat. There will be time reserved at the end to address questions received. All right, are we ready, ladies?
Ready.
Let's go. What is a female condom? What are the pros and cons of a female condom? And is it better or just as good as a male condom? Who would like to take that on?
You want to start?
I'll start.
Yeah. Yeah.
Well, and of course, I come from a lot of the social aspect and just conversations about the community. One of the things that's good about the female condom is that it gives more autonomy to the female to make the decisions based on her protection and her sexual health. And instead of depending on someone else to make that decision or have to coerce them to use something, then basically she's protecting herself in a way, again, it gives her the autonomy and also the privilege of saying, hey, this is what I want to do. So I think that's a plus for the female condom. I think one of the deficits in the female condom is lack of conversation, especially in Black and brown communities. Really not talking about the fluidity of options as far as, birth control options and stuff like that, and preventing sexually transmitted infections and diseases, and just not introducing it. So many times when you're talking to people in our communities, they are like, I've never heard of it, I'm not comfortable. So one of the biggest things I would say is, giving them the education, the experience, and the opportunity to try it out and see, if it's good for them. So that's one of the things about the female condom. And again, the female condom, is different in that it's being inserted themselves. So again, they have to be comfortable with touching their own bodies, their vulvas and their vaginas and different things like that. But I'm gonna let the rest of the panel talk, because we could talk about this all day. But these are some of the things that I hear from the community when they're saying, "Hey, I'm not comfortable with this." But Thank you.
Yeah, I might hop in here and add to the benefits. And I really want to uplift and highlight, Lynette, when you were talking about like the sense of autonomy and agency, right? That we're not waiting for, if we're having sex with a male partner, right? That we're a person with a penis, we're not waiting for them to show up with materials, right? That you got your stuff and you're ready to go and have a good time. An additional benefit that I would add to that is that for anyone who might have a latex allergy, this is a really great option, right? That the majority of our condoms are made out of latex, and lots of people actually have latex allergies. For folks who are experiencing lots of dryness or discomfort or itchiness or texture problems, it can be really embarrassing and you don't know where to turn. And so you might consider you might have a latex allergy. And so an internal condom, or a female condom as they're sometimes called, is made of polyurethane, which is a type of body safe plastic. And so it can actually be really health supportive in that way. And, for what the cons are, they're not always as available as some of our typical external condoms. And so you might have to do a little bit of looking to find them. They are often at some of your major retailers, but you might have to do a little digging to figure out where they are.
So when this session ends, I'm going to find the local pharmacy and look for a female condom.
Oh, I sure hope you
It's
do.
something that we should become more engaged with and to teach others about. And it's something we should not be ashamed of, because as you both described, it is something that could actually help us. We don't have to wait for the man to say, well, hold on there, or I forgot my condom. You can go, I'm ready, baby. Let's go. Dr. Vaughn, is something you'd like to add to that? You're muted, Dr. Vaughn. We can't hear you, Dr. Vaughn.
Can you? Yeah.
You good? Okay. All right. While we wait for Dr. Vaughn to unmute herself or figure out what's going on, her sound is off for some reason. I'm going to go to the other part of it. Sex and pain with intercourse and endometriosis. Can we talk about that? Who would like to address that? Who could address that while we wait for Dr. Vaughn?
I can start us off.
You can start it.
Yeah.
I'll piggyback on you. Go ahead.
Sure. So for anyone who doesn't know what endometriosis is, it is a pain disorder, right, that happens to the tissues of your uterine lining. And so what happens is there is very sensitive, delicate tissue that is supposed to grow on the inside. It's supposed to line your uterus. And sometimes what can happen is that same delicate, nerve-sensitive tissue can grow outside of the uterus. And so if you could imagine things that are supposed to be on the inside growing on the outside and being interacted with, being bumped on, or pressure or friction is very painful and very uncomfortable. And so for the folks who struggle with endometriosis, what I will say, and I'll leave room for other people's expertise here, what I will say is the way that often shows up in my office is it's post a diagnosis, so they already know what is going on. But what can happen for folks is that it becomes a cycle of fear. Right? So what happens when we anticipate pain is we brace. And what we actually want, I know we are, we can speak plainly here, yes, right? So we are often here, for gorilla grip and,
Right.
tight grip, and we think very much about our pelvic floors needing to be tight for pleasurable intercourse, particularly for our partners. But what happens when we are too tight, right, is that it creates a lot of pain for you. And so with endometriosis, when you're bracing against pain, what do? Your body tightens. And so it becomes a circle of pain, such that even when we're navigating, the pain and we have proper tools, right, or interventions, we're still just feeling so much fear and tightness. Right. And so that maintains the pain. And so I wanted to name that because people don't often know or recognize that sometimes the pain, even post sort of treatment, if we might call it that, right, is from I'm afraid that it's going to hurt.
So it's more.
So I think,
can
you hear me? Okay.
We can hear you.
Yes.
All right. So I think that's a really good point, because there is an intersection between pain with sex, and the reasons for that are so many and so long. And endometriosis, I think that your description of what endometriosis is was very on point. But you can have pain with sex and not have endometriosis, and have endometriosis and not have pain. So, endometriosis is chronic. So you have that chronic pain, and as you said, that elicits fear, the tightness, as you said. But in addition, the treatments themselves can be difficult. Sometimes it's treated with surgery. Most often it's treated with medication. And there is one particular medication that is designed to help with patients who have endometriosis and pain, with periods, but also pain with intercourse. Mm-hmm. You can also get pain from the scarring from endometriosis, even after it's been treated. So, this is a long process, and, you might have to see a pain specialist, which is going to be different than your gynecologist. You might have to see a physical therapist who does pelvic pain physical therapy. because, there is so much to unbundle there. And endometriosis really is a problem of reproductive age women, not so much of menopausal women, because you're not menstruating. And it's when you menstruate that the endometriotic tissue bleeds in the places where it is. So it's bleeding where it's not supposed to. And that sets up a whole cascade of pain and scarring and whatnot. And there are some experts in the area who deal with that. So if you're somebody who thinks you have endometriosis and different things have been tried, birth control pills usually are the first go around, but then there's a list of other medications and treatments. I would encourage you not to give up, but to keep looking so that your problems get treated in the appropriate fashion. And people should take you seriously that it does hurt.
Yes.
And if you go to your gynecologist and you say you have pain with intercourse, they should do a good history, but you also have to do a very specific kind of pelvic exam to figure out where the pain is coming from.
Yes.
So that you can then focus, the doctor can then focus on what possible therapeutic interventions are going to be helpful. So just your regular pelvic exam isn't going to do it.
Okay, thank you. All right, so I'm going to move on because we have quite a few things to get through, and I want us to touch on at least a little bit of each of it. We're talking about relationships. What is considered abuse in a relationship? Is it just physical? Is it emotional? Is it a combination of both? Is it even being ignored? What is considered abuse in a relationship in your estimation?
So what I would consider abuse is anything that makes you feel less than, anything that diminishes you. And most people think of it as physical, but in fact, a lot of abuse is verbal abuse, constant insults, as I said, making you feel less than, but it can also be refusing to wear condom, or forcing you not to use your contraception, or limiting your access to your friends and family, or checking how many miles you drove on the car. Abuse in its way is an imprisonment of you. And sometimes it's hard to recognize. And even once you recognize it, nobody wants to feel that they are being abused or that they don't realize that they're being abused. But there are many, many forms. And I think we focus mostly on the physical, but other things can happen. And I just want to say one more thing about verbal abuse. A lot of the verbal abuse will then move over to physical abuse. So if you feel you're being verbally abused, you need to be on guard that you may end up being physically abused as well. So I'm going to let the other women speak.
Thank you so much. Anyone else would like to add to that?
Yeah, I can. When I'm working with folks and they have this question of is it abuse? One of the ways that I like to talk about it, and it's similar, to what was just shared, but it's quite often when one person is using their power to overpower another person for their own gain. So we have been talking a lot sort of in pop culture about gaslighting, right? When someone repeatedly undermines you to the point where you doubt your own truth or your own sanity, right? We can talk about physical abuse, right? Where someone uses their own financial position, right, to manipulate or control. And control is going to be a thing that we can actually track through the relationship, because it can be really hard, as was being shared, for us to parse the difference between when my feelings are hurt or when we are just having a difficult time or when I don't like what you are saying, versus when I'm in a relationship that is, we would use words like toxic or unhealthy or sometimes unsafe. Mm-hmm. And I want to invite people, particularly women and particularly women of color, to really take the time to listen to the inner voice. And I know that sometimes we don't give ourselves the permission because of the larger cultural narrative that we have to be strong and we have to be resilient and we push through and we have to carry, if you have a family, you know, my family is counting on me to listen to the voice. There is a voice inside that says, this does not feel good and this does not feel right. And for us to take a moment to notice, okay, where does that show up for us? Right? What are the behaviors or the activities that make me feel, as was just named, unsafe or less than, controlled, isolated? And for us to take those really seriously and to seek support. And it doesn't always mean the relationship has to end. I've worked with a lot of folks who've been able to change the dynamics of the relationship, but it really does start with the person who is being harmed to acknowledge that harm and for them to believe themselves when they're saying this isn't good.
Right. Agreed. So I'm going to move on a little bit and ask this question. Can I still get a sexually transmitted infection even if my partner has been faithful? I cannot tell you how many times that has caused an issue, right? Where someone gets a yeast infection or a bacterial vaginosis, or you name the thing, right? And they say, somebody's been unfaithful. It's got to be your fault. Can you get a sexually transmitted infection even if your partner has been faithful?
Well, one thing that I want to basically differentiate is when you're talking about an infection or a disease is coming from yourself, like, urinary tract infection or different things like that, or we're talking about a sexually transmitted infection is coming from sexual intercourse or sexual behaviors. Because one thing is, people might say they're faithful, and they might be talking about intercourse, and they might not be talking about oral sex and other types of sexual play with toys and other things, or fingering, different things like that. So again, you really have to be specific in language. And again, you can get vaginosis and urinary tract infections and different things on your ownness. So it might not be from, dealing with a partner per se. But again, I really like for people to have language that is explicit and talking about people's experience, because even when we talk to doctors and different things, many people who we service in the community, they'll say, are you sexually active? And they don't think oral sex or toy play, all of these things are, considered sexual behaviors. Or if they're having sex with a same-sex partner, they don't necessarily think of it. So again, really having these open conversations. So there is a differentiation between sexually transmitted infections and diseases, and when you're just talking about, diseases and infections that you might get on your own because of, hygiene, health, or different things that are going on with your body. So I think that's my answer. So be quiet.
We can't hear you again.
Uh-oh.
Yeah, we lost you again. That's okay. It's okay. We'll just
Technology only works when it works.
It works when it works, right? So here's my other question.
I will just add on to that, if that's okay.
Go ahead, sure.
Yeah, I'll just add really quickly that in terms of some of the things that you might see pop up, even when a partner has been sexually monogamous with you, for example, something like HPV, right, which can be passed through, vaginal, anal, oral sex, doesn't always develop right away, right? Can take years to develop. So this might have, and particularly people with penises tend to be carriers and asymptomatic. And similarly with chlamydia, it can take a really long time, or you could be asymptomatic for a really long time. And so it could have been from a previous relationship, right? If they've had unprotected sex with, or if anyone has had unprotected sex with a previous partner, it could take some time for, the infection to incubate and manifest. So my advice for folks always is to get tested, right? To get tested as they enter a relationship, but then at your annuals to request them. And I know that, costs can be a barrier, so we can be considerate of that, but it apart from the money, right? I want to acknowledge that again, right? But that your health is a worthwhile investment. And so being able to stay on top of what's going on with your body, right? And to be able to detect things before something has flared up or has become a problem is really going to be the best relationship that we can have with ourselves, and a huge support to our relationships.
And is it not true that the undetected viruses like the HPV, genital warts, and things like that can lead to infection within the uterus that can also lead to cancers? Is that true or not true?
Yes, HPV definitely can lead to. Wait a minute, she's trying to say something to cervical cancer.
We still don't have sound for you. I'm not sure. If you want
But
to
yes,
check
it
out
can
the
lead to
second-
different types of cancer.
Yes.
Especially the
particulars.
HPV virus. And that's something that is really carried by many people, and they do not know. They go undiagnosed because they really don't get the test that they need. And it also can cause different types of throat cancer also when you're talking about oral sex and different things like that. So yes, different things that lay dormant can lead to different forms of cancer.
And so this isn't to scare people. This is to invite folks to make requests of their providers, right? That this is a service that you're being provided. And so be vocal and say, I would like to get screened for this, because unfortunately it's not included in any of our regular or annual screenings as you get older.
Dr. Beverly Vaughn says that it won't cause uterine cancer. So
Not uterine, I think cervical.
cervical. Okay. All right. So moving on.
I said cervical, not uterine.
Yes.
I said
Okay.
cervical.
All right. One more question in this part. Is it normal not to want to have sex after 1 or 2 babies?
Yeah, I can start there if you want.
Go ahead.
Yeah. There are lots of reasons for folks to not want to have sex, right? And while, I don't move based on sort of big picture normal as like the standard, right? Normal is frequency data, right? So if we're saying is it common? Yes, it is common, right? And if you want sex in a different way, like if you are saying I no longer have desire and I want that, in some way it doesn't matter anymore whether or not it's normal, right? I want to invite us to, even if it's not a big deal, according to sort of a medical threshold, if it matters to you, then it matters. And so if you're saying I would like to have a different relationship to my body, I'd like to have a different relationship to sex, right? Your hormones change, your schedules change, your needs change, your relationship changes, the sex you have or the sex you want all change. And so it's worth investing the time and the energy, if you're saying I would like to make it different, to follow through on that.
All right. Lynette, there's something you'd like to add to
I just
that?
wanted to say about that also, we have to be cognizant of body image and self-esteem, especially because our bodies change. The way we look change, the way we interact with our partners change. So I think one of the biggest things is we don't necessarily create spaces to have these conversations with our partners, to talk about the fluidity of different sexual positions. Because again, the fluidity of understanding, that maybe I want to be held a little bit more, I want a little bit more foreplay, different things, because after a vaginal birth or a cesarean birth, things might change in a way that, of course, even the mother might not be aware of it, because this is all new to her and things are changing. And then also her time with having to take care of a child and also breastfeed and nurse and all these different things. So again, I think we need to leave space for conversations about how is our sexual life changing, and how am I viewing myself, and how I view how you treat me because of the changes in my body and the changes in my life.
Absolutely. All right, so we're moving on to part 3 of this conversation. Urinary incontinence. This is the post 50. This is the part that I have just been waiting for. I go out with my friends who are post 50 and we all say, you can't laugh too hard, can't cough too hard. What's happening there? Is it normal? Is urinary incontinence normal? Is there anything we can do to reverse it?
So hopefully you can hear me, even if it's for 3 minutes.
Yeah.
So to answer your first question, incontinence is not normal. People will say, oh, I'm getting older, I know it's supposed to have It's not normal. Is it common? Yes. Does it have to do with whether you had a vaginal delivery or you had a C-section? Nobody knows. Is it related to how many babies you have had? But there are women who've never been pregnant that have it. And you have to figure out, and this is what the doctor needs to figure out, or your healthcare provider. It can also be a midwife or a nurse practitioner, what kind of incontinence you have. There's the cough, sneeze, which is stress. There's the urge that says, oh my God, I'm never gonna make it to the bathroom. I have to go right now. There's some people have both, and some people have times when they just drip uncontrollably. And you have to investigate each thing because the causes are different. Urge incontinence can often be rectified just by changing your diet. So I know, how easy is that? So if you have alcohol, caffeine, soda, anything that's fizzy, artificial sweeteners, the list is actually really long. Even acidic foods like orange juice and whatnot, or large volumes of liquid, that can give you urgent incontinence. So I have patients that I say, look, stop doing this. And they come back and go, oh my God, it's all gone. Kegels are also helpful, but you have to have somebody to teach you how to do them, because there's a right way to do them. And your healthcare provider should be able to show you that. Or you can go to a pelvic floor physical therapist who are quite expert. And if you have stress incontinence, that's a little trickier, because that's muscular weakness, for lack of a better term. So that may need to have a surgical fix, but pelvic floor physical therapy can help that as well. So other things like, sometimes it's your medication that you're taking, right? So if you're taking a diuretic, you're just going to pee and maybe not get there. So people have to look at that. Because incontinence, being overweight will, I won't say it will cause it, but it'll exacerbate it. So it's not a one-shot fix, but you have to really pick it apart to figure out what the cause is, and then go after what the cause really is.
But there are many women at all ages who are experiencing some of these things, and there's an embarrassment to going to the OBGYN and asking. The OBGYN will ask in their annual pap smear, annual visit, and they'll ask these questions, and they're so embarrassed to talk about it, but they'll have the conversations with their friends secretly and try to figure out remedies on their own. How can we encourage women to be more open at their doctor's visits?
So I think, going back to the title of the conference, questions you've been too embarrassed to ask, you should never be embarrassed. Also, the healthcare provider needs to ask you. Some healthcare providers don't. So if it is something that you have a question about or you're concerned about, you need to feel that you can ask. You're the most important person to take care of yourself. So you need to ask. And remember, it's really hard to embarrass a GYN. We've heard everything. So do not be shy. And you know what? If you're too embarrassed to ask in the visit, make a phone call later and say, you know what? I forgot to ask about this. Can we talk about this for a few minutes? So, and I think many of us don't have the language to talk about these things comfortably. So I think that's part of the difficulty. And I think women often feel shamed by the fact that they have incontinence, and they think that it's their fault, they did something wrong, and none of that is really the case. But it's not going to get any better if you keep it a secret. So there should be no secrets between you and your gynecologist.
Okay, which means you then would have to find the perfect doctor that you can have the conversations with, because the doctor matters too. The doctor has to be warm and welcoming and inviting and not rushing the patient, et cetera, et cetera. All of that makes a difference. Here's the last question that I have. Hormones. Are there any risks with hormone replacement therapy? And how are my hormones affected if we take hormone replacement therapy? And is there anything I can do to negate imbalance? How do I control mood swings? There's a whole lot in that one question.
So that is a whole hour and a half or two.
Which we don't have.
All by itself. So let me start with why somebody needs hormone therapy. First of all, not every woman needs it. The main reason for hormone therapy is for women who are having hot flashes. If you're not having hot flashes, you don't need it. Now, are there some variations on that theme? Yes, but primarily it's hot flashes. So it's not like, oh, I'm menopausal, I need to be on hormone therapy. It just is not really the case. People always talk to me about, oh, can I get hormone levels to see where I am? The hormone levels vary from hour to hour, day to day. They don't really correlate with anything in terms of symptoms. So, it's not something that is useful at all. And the question about safety, if you are someone who is healthy, who is less than 10 years out from menopause, who doesn't have, obviously, breast cancer or any uterine cancer would be, somebody who couldn't have it. If you're somebody who has had a blood clot in your lung or your leg, if you've had a heart attack, those are all things, or a stroke, those are all reasons that you are not able to take hormone therapy because it is unsafe for you. But if you are a healthy person, then talking to your healthcare provider about, is this right for you, is certainly reasonable. And I know we all hear, oh my God, it causes cancer, causes stroke, and in fact, it doesn't. So it won't cause uterine cancer, particularly when you have a uterus, if you're taking estrogen and progesterone together, won't cause uterine cancer. If you've had a hysterectomy, obviously it's not going to, and all you need is estrogen. The information about breast cancer is really confusing, but the article from which that information came and blasted all over everywhere, actually, there weren't that many women that got breast cancer. It was a very limited number. And the information about heart attack and stroke in that study, all of the women were far out from menopause. I mean, the average age was like 62 or 3. No GYN is going to give women of that age just out of the blue hormone therapy. So the goal of that study was really to see, does estrogen protect against heart disease, based on some other things I won't go into. And what it found is that it didn't. So is it safe in the right person? Absolutely. But, you have to go through what, the components of the right person. Is it risk-free? Completely no, but neither is aspirin or Tylenol. So you have to be aware of what those risks might be, and you have to balance, am I concerned about developing a blood clot? Well, that's about 2%. So, it's a discussion. It's a discussion.
Yeah. One of the things that I wondered why we don't talk more about natural herbal remedies versus doing some of these other things that's not exactly risk-free for us as a people, as a culture, and as a people. We've grown up knowing about these natural herbal remedies that we've done. You hear my Jamaican accent, so there are things that we can use, and we talk about it another time because we don't have enough time for this today. But how do I control mood swings? And then I'm going to ask Lynette a specific question. How can we control mood swings? Every woman that I know, for the most part, who is in post 50 and going into menopause, perimenopause, or full-blown menopause, the mood swings are a real thing. How can we control the mood swings? Lynette, you want to answer that?
I was going to answer it. It could be
frozen.
Hormonal therapy.
While she's unfreezing, I'm big on meditation and mindfulness. Those things can help with the mood swings.
Okay.
Can you hear me?
I could hear you.
So are we all
Okay,
frozen?
so what I was going to say is,
It's just you freezing, Dr. Vaughn. I can hear her. Go ahead, Lynette.
okay, I was going to say, so one of the things too was that, and she started talking about yoga, meditation, and self-care. That's one of the things also, because again, we're stressed out, we're frantic about it. I'm over 50, so I'm talking from experience. Worrying about these hot flashes and different things like that. So sometimes taking some time, deep breaths, meditation, and really focusing your mind, because again, sometimes we're getting frazzled, we're getting overwhelmed, and all of these things things, again, because hormones and different things are taking effect within our bodies. So those are some things, and also some other, like you said, homeopathic methods that are out there, different herbs that we can have, different teas that we can have, and different things like that can basically calm ourselves and calm our moods.
Absolutely.
I want to name really quickly here, as a person who's not over 50, but navigating a lot of emotional experiences with folks as a psychotherapist, this is not a remedy for how to not have mood swings, but I want to name here that especially for folks who are in their 40s, in their 50s, in their 60s, to have mood swings is often the first time in a very long time where they didn't feel like they could keep their emotions under control, right? That like, I'm having a feeling and I can't just swallow it and do the thing anyways. And I want to invite another form of intervention is to start shifting the way you move through the world, and this can start at any age, to invite your feelings to be a normal and natural and important part of your lived experience. And that doesn't mean that because I'm angry, I'm gonna rage at my partner, or because I'm sad, like I'm not gonna get out of bed today, but to give yourself and your body the permission to actually respond to your emotional experience makes the experience of having even labile moods feel less of a crisis, because you're well practiced that like I'm a human being with feelings and that's okay.
I love that. I love that answer. So Lynette, I have a question for you. How do period panties work? And how does the cup work? And are they better for certain age groups?
So the period panties are a sustainable, reusable methodology to deal with your menstrual cycle. And they basically, you wear them like regular underwear, but they have a thick padding. Some brands have a thicker padding like Period.co. Then things might have a thinner padding, but they have a technology that absorbs the blood. So what it does is you wear them and it absorbs the blood, and then as it gets filled or whatever, you can put on another pair or whatever, and you can use them throughout the day. The cups are something that's inserted into you. It is it's a cup, and you insert it almost like a tampon, but you have to fold it so that it can be inserted into. You can be the S fold or the down fold or whatever. They are a great sustainable, reusable option too. You don't have to worry about toxic shock syndrome. You don't have to worry about sleeping in them, because again, they're made of silicone, and so you won't get those type of infections. And all you do is you insert it, it catches the blood, you dump it, clean it out, and you can insert it. You can keep it up to 5 years. So again, those are economical ways of dealing with your menstrual cycle. I encourage people to use them, but again, because we deal with different people in our communities, people who have socioeconomic issues, or people who are in period poverty, and then other people who are looking for other options. So some people who we work with in our communities, I do not recommend them because they don't have ongoing running water, waste management. They have their housing insecure, so they can't properly clean some of these things. So it would cause more infection and disease. So I'm not really helping those populations. And then also we work with a lot of populations that do not believe in insertions, culturally, religious, other things that they don't believe in insertions, so they might not want menstrual cups. But if you are okay with all of these things, you're able to clean it, sterilize it, take care of it, store it, and those things, I think these are great options. They save the environment, but they also save you thousands and thousands of dollars, because you're not buying these products. So I always recommend, if you can get a menstrual cup and a reusable pad or period underwear, then that is actually saving you and your family thousands of dollars.
Thank you for sharing that. I appreciate it. Dr. Vaughn, you have a two-part question. What can I do to be prepared for my next gynecological visit? Thank you. There you go. Brain's not working at 8:00 at night. My next gynecological visit, and how do I develop a better relationship with my gynecologist?
All right. So I think the first thing is to know what your goal is for the visit. If you have questions, write them down, because once you get there, and this is true for all of us, once you get there, you can't remember them all. And you, again, don't be embarrassed to ask your questions, because if you don't ask the question, we're not going to know that there's a concern that you have. I also think you need to be really aware of what your family history is, because sometimes those things are going to come to bear on your current and future health. You need to know what your own history is. What was your obstetrical history? And it's actually important to tell your GYN, well, you know what? I had diabetes during my pregnancy. I had preeclampsia, because those things will come to roost later, because it may increase your risk for heart disease. So you need to know as much as possible. If you had an abnormal pap smear, try and remember the details of that if you can. If you're transferring from a different person, get your